Here is your question. There are 2 slides. Once you are done reading this one, please tell me. I'll move to the second one.
Okay.
Can I change, please? Last
Brush.
10.
Yes, it's okay.
Yes, this is the question.
Short.
Okay, Bella is gone. So if, right.
It's
If you have
okay.
read and understood, considering 8 critical care scenario, please tell me, how would you manage this lady now?
Managing this lady, central abdominal pain. She presented with the signs of what looks like acute pancreatitis.
Good.
Differential diagnosis could be
No,
perforated.
please, just tell me the management first.
Just management.
Considering it critical care scenario.
Yes,
Yes.
I will manage her according to CCREST protocol
Yes.
ABCD.
Yes.
Regarding her we will manage also her pain with painkillers, and also we will support her with central line and IV fluids, IV antibiotics, a proton pump.
Okay, right. Thank you. Please
Okay.
tell me, what are the differential diagnoses after reading the scenario? What are the different differential diagnoses that you'll consider for this patient?
I will consider acute pancreatitis,
Yes.
perforated ulcer, acute gastritis, acute
Yes.
colitis.
Very good. Or the perforated viscous. Please tell me what might be the causes of acute pancreatitis.
Causes of acute pancreatitis could be infectious,
Gallstone.
or
Yes.
could be secondary to gallstone.
Yes. And
Could be
you were saying infection. Yes. And
yes, could be infectious,
or could be because
or
of
could be just
alcoholic drama.
post-traumatic.
Yes. Trauma. All right. Good. Very good. Please tell me the pathogenesis behind acute pancreatitis.
Pathogens, acute pancreatitis happen due to obstruction in
Duct. Yes. And
in the and back pressure to the pancreatic cells, and due to leak of pancreatic enzymes will lead to autolysis of or inflammation in pancreatic tissue.
yes. All right. And there are many, 2, 3 more as well. Please tell me, how would you determine or you will establish your diagnosis?
Diagnose according to we will do labs and imaging.
Yes.
Labs will like in ER we ordered amylase and lipase.
Yes. Please tell me the criteria that you'll consider for the diagnosis of acute pancreatitis.
Criteria.
Yes, please. Which criteria? Glasgow criteria and
Okay.
there are 3
The
more. Ranson criteria.
yes,
Please
ransom
tell me
criteria.
Ranson criteria 48 hours after admission.
Yes.
What is it? Okay,
According,
we'll come back to this later. Please tell me, this patient is tachypneic. Can you explain why?
tachypnea due to
Yes, because of abdominal pain and
abdominal,
sympathetic overdrive and What is
Okay.
ARDS? Can you explain or describe?
ARDS, it's acute respiratory stress syndrome.
Yes.
It is
What happens in ARDS? There is
VQ
VQ mismatch due to, and there is
due to
pleural effusion. Yes.
pleural effusion and pulmonary edema.
Okay.
Okay.
Right. Please tell me why this patient has hyperglycemia.
He
What are
has
the causes?
hyperglycemia due to lack of insulin release from pancreas.
Which cells of pancreas? Please be specific.
Beta cells.
Of iris of
Yes.
Langerhans. Okay.
Langerhans.
Please
Okay.
tell me, if you fail to manage this patient on time, what are the complications that you expect?
Peritonitis, pseudopancreatic cyst.
Yes.
Patient could go for in shock, even septic or hypothalamic.
Okay. So how would you say? Multi-organ failure, right?
Multi-organ failure could be
Yes.
ended with multi-organ failure.
Right. How would you take
Okay.
care of the nutrition of this patient?
Patient will need TPN and maybe may need nasogastric feeding.
Yes. Good.
Nasovaginal feeding.
Nasovaginal, yeah, right. Okay, please tell me, would you or would you not consider giving antibiotic to the patient?
I will consider giving the patient antibiotic.
According to the trust guidelines, okay? Right.
Okay.
Please tell me, how would you manage the pain of the patient?
Pain of patient should be managed with uh, BCA with good analgesia and BCA, but we will avoid non-steroidals and opioids. Non-steroidals for fear of peptic ulcers, and opioid for fear of obstruction of or spasm in ampoule of water.
Please
So
tell me, what do you understand by the term WHO pain ladder management?
WHO step ladder for analgesia.
Yes.
We will go first step for paracetamol paracetamol or non-steroidals, ibuprofen.
Yes. And
Second step, we will go for weak opioids like codeine or tramadol.
very good.
Third step, we will go for strong opioids like uh,
Please,
um,
you were telling me
morphine, and
morphine, yes.
yes.
Okay, please tell me, how would you, you said that one of the complication could be pseudocyst formation. How would you
Yes.
diagnose the pseudocyst formation?
CT scan,
And
ultrasound,
what other ultrasound? Then
ultrasound.
CT scan, right?
Yes.
Anything else? Any
Uh,
therapeutic management that you can suggest?
we could therapeutic for
Yes,
management of pseudopancreatitis. We go for conservative management
conservative, but yes,
and surgical management in case of if the cyst is more than 5 centimeter or
yes.
history go for more than 5 weeks, or it has a thick wall.
Yes, all right. Okay. Can you tell me what are the blood results that leads you to suspect that patient could be having pseudocyst?
Pseudocyst.
Yes. What
Uh,
blood results can be
CRP will be elevated.
no and serum amylase?
Serum amylase. Okay.
Right. Okay. Right. Thank you. Time went. Good. Thank you.
Okay.